gray Geneva. Good morning to colleagues in Americas. Good afternoon and good evening. It's a great pleasure to have you here with us. My name is Emanuele Capobianco. I'm the Director of Health and Care here at IFRC, and will be your master of ceremony. We have a fantastic hour and a half ahead, so I will not waste time. I will ask, if possible, colleagues to mute your mic. Once again, welcome and thank you for making the time to be here today for the launch of our new report on law and public emergency preparedness and response, lessons from COVID-19 pandemic. We know how incredibly busy everyone has been over the past year and a half, and even as we head into the summer months, we know how critical the phase of the COVID-19 response is at the moment. What we are presenting today is a report that was initiated at the beginning of the pandemic with the support of the German government and the British Red Cross. And while it builds on over 100 years of experience preparing for and responding to public health emergencies, together with our 192 member national societies, it focuses predominantly on the COVID-19 pandemic, drawing many of its conclusions from countries' existing laws and frameworks related to public health emergency risk management, the laws relevant to protecting vulnerable groups during a public health emergency, and the legal facilities provided to humanitarian organizations to enable them to carry out their life-saving work in the right conditions. The analysis and the recommendations in the report have been synthesized in a much shorter document, which is a guidance on public health emergency and response, which is still in a draft pilot form and will be finalized in the coming months after a series of regional consultations. And as a key decision makers, researchers, and advocates in health and emergency response sectors, we have invited you today because we strongly believe the report's recommendations can contribute to the important discussion we have had over the past few months at the WHO, within the G7 and G20, as well as the upcoming discussion over next year, where we have several key opportunities to strengthen and ensure better alignments of legal frameworks at all levels. As such, it is important for us to coordinate lessons learned with you and to hear your thoughts on how we can best use this key piece of research. So, moving ahead, we have three parts. The first part of this event will hear introductions that try to provide an overview of the context and relevance of the report. Second, we will have a presentation on the highlights and key recommendations from the report. And then in the third segment, the panelists will, and it's an excellent group of panelists, will share best practices and lessons learned in the response to the COVID-19 pandemic in different countries. So without further ado, I would like to start with the first three distinguished panelists, and we will start with my own Secretary General, Mr. Jagan Chapagain, who will then be followed by Dr. Elke Löbel, Commissioner for Refugee Policy and Director for Displacement and Migration, Crisis Prevention and Management at the German Federal Ministry for Economic Cooperation and Development, and followed by Dr. Loyce, Director of Global Affairs for the US Department of Health and Human Services. So with that, Mr. Secretary General, the floor is yours. And if you could kindly unmute, Mr. Secretary General, thank you.
Okay, now you. Okay. No, thank you, Emanuele, and thank you so much for everyone joining this, in my view, very, very important event this afternoon here in Geneva. Thank you for joining from all over the world. I know it's too early for colleagues from the Americas and getting late in Asia Pacific. So thank you, everyone, for joining, and really, really warm welcome for the launch of this IFRC's new report called Law and Public Health Emergency Preparedness and Response, Lesson from the COVID-19 Pandemic. I think this is in this form now, and as Emanuele described, of course, there is more work to be done before it gets finalized. As you know, while no one has been spared from the effects of COVID-19, the consequences of this pandemic have not been equally felt by everybody. This crisis has been defined by profound and persistent inequities, both in terms of who is most at risk and how the world has responded. Despite strong verbal commitment about global solidarity, support the most vulnerable, the fact remains that the richest 50 countries have carried out, on average, 39 times more tests per capita than the poorest 50 countries. This is just a fact. People living in developed countries are nearly twice as likely to be supported with contact tracing for COVID-19, a critical public health intervention that prevents transmission and reduces exposure to the disease. And only 2% of vaccine doses administered have been in the world's poorest countries so far. And unfortunately, we are not seeing the speed that is required to change this inequity in vaccination. We may not have known back in January 2020 the full extent of what was to come, but we certainly knew that a pandemic of this size was only a matter of time, and that we could have been better prepared to respond. And actually, together with the US government, we had been working on a pandemic preparedness program in a number of countries in Africa and Asia. So we knew something was coming, but clearly we were not prepared. If the COVID-19 pandemic has taught us anything, it is the importance of being ready. And central to being ready is the role of law and policy in combating public health emergencies and in protecting communities in an equitable way. Legal and policy instruments have underpinned many facets of the COVID-19 response, from unprecedented restrictions on freedom of movement and assembly to expedited vaccine approval. These are all linked to laws and policies. However, levels of success in using legal and policy instruments to respond to the pandemic have varied widely. In some cases, existing laws and policies have proven to be outdated or inadequate by more than a century, actually, in many countries. Restrictions introduced to curb the spread of COVID-19 have also constrained some national Red Cross and Red Crescent societies, their staff and volunteers, to perform their critical auxiliary role and fulfill their humanitarian mandate as first responders to disasters and emergencies, and in providing community-based health and social care to the most vulnerable population. Since 2003, the IFRC has been providing advice and support on how to develop and implement effective disaster laws around the world. In this new report, IFRC analyzes the role of law and policy in supporting preparedness and response to public health emergencies, with the focus not only on the COVID-19 pandemic, but also on other major public health emergencies in recent history caused by, for example, the Ebola, Zika, and SARS viruses. The findings of the report indicate that urgent action is needed to strengthen domestic laws and policies for public health emergencies and to protect the most vulnerable in need. When governments around the world emerge from the current crisis, many will wish to draw on the experience of the COVID-19 pandemic to review and strengthen their legal frameworks for disaster risk management, including public health emergencies. This report and its accompanying guidance document, Guidance on Law and Public Health Emergency Preparedness and Response, will provide valuable resources for government embarking on this endeavor. Through its work on disaster law, the IFRC has 20 years of experience working with our member national societies to provide technical advice to governments that are reviewing and updating their disaster-related laws. So together with National Red Cross and Red Crescent societies around the world, we stand ready to assist governments who wish to improve their legal preparedness for public health emergencies as well. Because I believe that we have wealth of knowledge that could be extremely helpful and will not require to reinvent the wheels, which unfortunately at times happens. I want to take this opportunity to thank the British Red Cross and our partners like the Allianz Law Firm, the German Federal Ministry for Economic Cooperation and Development, and the White & Case Law Firm for their support in this very, very important work. I also thank Germany and the US governments who are here and who will be speaking just after me for their generous support, in particular to IFRC's COVID-19 response operations. Without your support, we would not have been able to reach hundreds of millions of people through our national society. So thank you so much. In a short while, our distinguished high-level panel will be presenting best legal practices and lessons learned in the management of the COVID-19 pandemic. They will also share innovative solutions and initiatives that will guide us to build legal preparedness capacity to be better prepared for future public health emergencies. We have a real once-in-a-lifetime opportunity to review law and policy for public health emergencies and consider what improvements need to be made. I remember the words of Benjamin Franklin. He said, "By failing to prepare, we are preparing to fail." Colleagues, not again. We cannot allow ourselves to get caught off guard again. We must act now. And we as IFRC, with our network of national societies and volunteers, are ready to work with all of you to make sure that we don't repeat the weakness we saw just before this pandemic. Thank you so much. Over to you, Emanuele.
Thank you very much, Mr. Secretary General, for your words and this very important quote from Franklin, which really sets the tone for today. I will now like to pass the floor to Dr. Löbel, who is the Commissioner for Refugee Policy, Director for Displacement and Migration, Crisis Prevention and Management in the Federal Ministry for Economic Cooperation and Development in Germany. Dr. Löbel joined the Federal Ministry for Economic Cooperation and Development in 2006, and prior to her current role, was head of the Middle East Division. She has also served as country officers for Sri Lanka and Nepal, and a senior policy officer in the Budget Division and the division dealing with civil society support. Before joining the ministry, Dr. Löbel managed the Exposure and Dialogue Program in Bonn, Germany, and prior to that was an aid worker with the German Development Service in Bolivia. Dr. Löbel, it's a real pleasure to have you with us. Over to you.
Ladies and gentlemen, dear Secretary General, it's a real pleasure for me to represent the government of Germany in the launch today. Thank you very much for this valuable work. With the program you present today, we support an internationally unique program for the development of laws and guidelines for preventive disaster risk management. It strengthens the leave no one behind principle of the 2030 agenda, which is a central feature of German development policy. So I would like to underline what you said. It's an important report, and thank you. Thanks to the local structures of and its unique access to the most vulnerable, the Red Cross is a key partner for Germany in this regard. So the local structure is so important to be present with the people all around the world. The guiding question in the report, as I understood it, is how we can enhance our disaster risk management regulations and make them more robust to protect our populations, especially the most vulnerable, as you already mentioned. In the current pandemic, we all face great challenges worldwide, and we constantly have to adapt to the changing situation. The most challenging issue, surely in the moment, is to have enough vaccines for everybody worldwide. And so I think, as you mentioned, it's so important to have solidarity worldwide, and Germany is playing its role. There's no single country with the one ideal response on the field of disaster risk management. We have to jointly evaluate what went well and what didn't, so we can improve our strategies and our setups. There are also lessons to be learned. And I would like to refer to Germany also, because it's not only our partner countries who learned. We in Germany, for example, learned that the federal system, certain responsibilities which lie with the federal state, that this didn't work out pretty well. In recent months, we saw that overlapping approaches, unclear responsibilities, certain areas that led to confusion and frustration in the pandemic, these all made us learn that different levels of state need to be linked more closely And communication is key for success. So we are also learning. It's not only our partners. To maintain trust in democracy and its institutions, it's a key task and challenge to communicate very well on all levels. So this is a lesson we have learned. If I look to our partner countries, I would like to share one example, which is, as you already mentioned, Secretary General, the Ebola epidemic in 2014-2016 showed us already some points. Germany and African disease experts jointly developed a disease control mechanism named SORMAS, Surveillance, Outbreak Response Management and Analysis System. It was developed and tested in Nigeria and Ghana. And the system was extended to the new COVID situation and is now also being used by German health authorities. So this is a great example how best practice from all ends can help us getting together. Cooperation is the word, solidarity is the word. To conclude, because you gave me 4 minutes, so I would like to talk about your wonderful work in the different countries, but I would like to conclude that public health emergencies are expected to occur more frequently. So health risks must become a priority in risk management plans and laws. There is a glory in prevention, especially in a pandemic situation. So what do we have to do if we want to be able to manage better? I would name some points. We have to learn from each other. If we do that, I think we can manage better. If we do systematically improve our risk management instruments, we will become better. If we maintain the flexibility to interlink the different tools, we will get better. And for me, the last and very important point, we have to understand, especially in pandemic situations, nobody is safe till we are all safe. So we have to help all countries to produce vaccines, especially in African countries. We already have some experiences, and we have to understand that we can only make it together. Thank you very much.
Thank you so much, Dr. Löbel. This resonates so much with our IFRC. The themes of trust, the themes of communication, themes of solidarity really speak to who we are and what we're trying to do in this emergency and other emergencies. So thank you very much for your contribution, much appreciated. Would love to spend more time discussing. We'll have time to discuss. If you have comments, place them in the comment chat, colleagues. But I'm now moving to our next speaker, and it's a great pleasure to introduce Mrs. Pace, who's the Director of Global Affairs in the U.S. Department of Health and Human Services. In her current role, Mrs. Pace is responsible for advancing the U.S. international health agenda through multilateral and bilateral forums. She is the Office of Global Affairs lead on setting priorities and policies that promote American public health agencies and interests worldwide. And previously, Mrs. Pace served as President and Executive Director of Global Health Council and was also a member of the Biden-Harris Transition COVID-19 Advisory Board. Mrs. Pace also has extensive experience working with community-based organizations and grassroots leaders in countries across Africa and Asia on campaigns calling for person-centered access to health. Mrs. Pace, again, warm welcome to you, and the floor is yours.
Well, thank you very much, Emanuele, and good morning, good afternoon, good evening to those of you who are joining from around the world. Of course, I'm very happy to be with you today, and it's really great to see the release of the report and just generally to hear about the work IFRC and its partners have been doing in the midst of this pandemic. And I have to, as the Director General has said, as have others, really thank you all for the work that you continue to do to respond to this ongoing pandemic. We're very much aware that we are not out of this crisis, and deeply respect and honor not only the lives that have been affected, but certainly the work of everyone who is trying to save those very lives. So I will echo some of what has been offered already, but then speak to some specific investments or commitments that the U.S. has made in this particular space. Legal preparedness, as we have come to understand in our own lesson learned, as Director Löbel said, is something that has been a missing link for a while, honestly, and it's something that COVID-19 has exacerbated or even further sort of helped us to recognize. And yet it's something that we arguably knew already, that legislation, regulations, this sort of work behind the scenes is essential for us to be able to respond in effective ways. Ultimately, we waste time when these measures aren't in place, and I think we've all experienced that. So whether it's regards to emergency personnel, as the Director General mentioned, or perhaps supplies like personal protective equipment, or even as has been mentioned and as we're all facing, the sharing of vaccines. I think we're learning real time, unfortunately, what it takes from a legal perspective to ensure we're able to provide or otherwise offer the very real assistance that's required amidst this or other public health emergencies. And so recognizing this gap in consistent decision-making and consistent process, the U.S. and specifically our Department of Health and Human Services has been working with partners of the Global Health Security Agenda and those member countries to stand up what we hope will be a sort of legal framework. And I have to acknowledge the work that's been happening alongside the government of Argentina, as well as the Georgetown University's O'Neill Institute for Public Health Law. We are very pleased to be able to come together with those partners to try and stand up what would be a legal action package, as we call it, under the Global Health Security Agenda. I'm happy to share more about that package, but just to say that it's really grounded in the fact that there isn't a global platform for countries to come together and design these sort of legal parameters. And so it's our hope that by using the Global Health Security Agenda, something that is already in place and that is rooted in country level action and decision making, that we can then pursue this track. And we recognize there's a wide range of legislative, regulatory, or other issues to be addressed, and there are opportunities to sort of establish distinct working groups, if you will. But the idea is to create a broad multi-sector network of technical experts that can look at this issue from various angles, and then ultimately propose a set of actions or recommendations that Global Health Security Agenda members, but also the countries the world over can adopt, so that we can close this gap and ultimately solve for this problem. We're grateful that the IFRC is ready and willing to be part of this working group and joining other institutions, governments, and additional non-state actors or experts in this effort. We recognize the critical role you play at the intersection of public health and preparedness, as well as disaster law and humanitarian response. And so, of course, you all would be a very valuable partner and a critical partner in this effort. But ultimately, it's going to take all of us to solve this problem and to understand the many facets that we all face, again, real time with COVID-19. So hopefully, knowing that this work is ongoing, this is even a lesson that we can sort of establish or develop solutions for that could even be applied today, but certainly tomorrow, should we be faced with a crisis like this again. And with that, I want to thank you again for having me. It's a bit early in my day, but as I've said, I'm really glad to be here and be a part of this discussion.
Well, thank you very much. And we would gladly bring you a coffee, a virtual coffee, to thank you for your contribution. And really, what strikes about all the three presentations is really the focus on legal preparedness, as you said, as a missing link. There is glory in prevention, was said earlier by Dr. Löbel. And somehow we don't necessarily hear about legal preparedness, community preparedness, disaster risk governance, or in the media or in speeches, but they are so key to national and international responses to public health emergencies, and they play quite a major role in helping save lives, keeping communities safe, in ensuring that the hardest to reach aren't left behind. So I wanted to thank you for this initial introduction. Please allow me to reiterate my deepest thanks to all three of you, understanding that you will need to leave, but we will continue the discussion with a fantastic panel and very much energized by your words. So once again, thank you, and we'll keep in touch on many of the issues. And with this, I would like to move to the second portion of our good webinar so far. I'm very excited about it, and we're going to go into the meat of the report with Isabelle Granger, who is the Legislative Advocacy Coordinator at IFRC, and she's the head of the IFRC Disaster Law. Mrs. Isabelle Granger has worked for the IFRC since 2005, and in her current role, she is the head of the IFRC Disaster Law team and supports the development of legislative advocacy initiatives by the IFRC network. Previously, Ms. Granger served as Disaster Law Coordinator for the America and a senior legal advisor to the tsunami operation in Southeast Asia. Her experience also includes providing legal advice on major IFRC disaster response operation, including the Haiti earthquake of 2010, the Ecuador earthquake in 2016, and the current COVID-19 pandemic. I'm gonna ask the panelists one or two questions, and you are all welcome to send your questions into the chat so that we can keep this as lively as possible. So Isabelle, can you please provide us with the background to the Law and Public Health Emergency Report and a brief overview of key findings and recommendations?
Certainly. Thank you very much, Emanuele, for introducing the Law and PHE report. IFRC Disaster Law has 20 years of experience in developing guidance on how to develop strong and effective disaster laws, policies, and plans. While public health emergency may sometimes be considered as separate or different to other types of disaster, they fall clearly within the definition of disaster adopted by the international community in international instrument. For this reason, in the Law and PHE report, rather than starting from scratch, we build on existing international recommendations and guidance relating to the domestic disaster laws, policies, and plans. In particular, the recommendation provided in the checklist on law and disaster preparedness and response, which was unanimously endorsed by the state parties to the Geneva Convention and the Red Cross Red Crescent components at the 33rd International Conference of the Red Cross and Red Crescent in 2019, and the IDRL guidelines adopted at the International Conference in 2007. While building on existing disaster law recommendations, the Law and PHE report also synthesizes a rich body of country-level research on law and public health emergencies undertaken during 2020. The country-level research was undertaken in a total of 131 countries from all regions around the world. The research focused on a broad range of issues, including the legal and institutional framework for public health emergencies, protection of vulnerable groups, mitigation of secondary impacts on human mobility and housing, and facilitation of the work of humanitarian actors. While the research focused predominantly on the COVID-19 pandemic, it also included analysis of previous public health emergencies, such as those caused by Zika, Ebola, SARS, and MERS viruses. While there's not enough time to summarize all the report key findings and recommendations, I would like to draw your attention to some of the most important ones. The report finds that many countries' laws and policies for public health emergencies are old, some even dating to the late 1800s or early 1900s. These laws tend only to apply to a list of specified diseases, some of which are no longer prevalent. The report therefore recommends that laws, policies, and plans for public health emergencies need to be reviewed and updated regularly to ensure they are fit for modern purpose and adopt an all-public health risk approach. The report finds that many countries still have not implemented the core capacity required by the international health regulations. It recommends that states should continue to take steps to ensure that their domestic legislation implements and facilitates the international health regulations core capacities, and should consider establishing a monitoring committee specifically to oversee implementation of the international health regulations. The report finds that a One Health, all of a society and all of state approach that facilitates the participation of all actors and stakeholders is not yet a reality in many countries. This is an important area for improvement. As we have seen from the COVID-19 pandemic, a large-scale public health emergency can impact or require action from virtually every tier of government, every sector, every region, every community, and every individual. The report finds that at the domestic level, there is limited evidence of there being duties on public authorities to provide early warning to the general population of health risk that may cause a public health emergency. Public authorities should be under a duty to give clear and actionable early warnings because this is critical to curbing the spread of a novel infectious disease. The report finds that the activities of humanitarian actors, including National Red Cross and Red Crescent societies, can be hampered by restrictions introduced to curb the spread of a novel infectious disease. It recommends that humanitarian actors should be provided with appropriate exemptions from restrictions during public health emergencies, subject to health safeguards. The report finds that, in some cases, border closures and travel restrictions introduced during the COVID-19 pandemic impeded the repatriation of migrants and the entry of refugees and asylum seekers seeking safety. It recommends that border closures and travel restrictions need to be subject to exemptions for these groups. And finally, the report finds that many of the impacts on vulnerable groups experienced during the COVID-19 pandemics were foreseeable and are likely to arise again during future public health emergencies. It therefore recommends that these impacts should be addressed in advance of public health emergencies through laws, policies, and contingency plans. As I mentioned, there is not enough time today to summarize all the report key findings and recommendations. I would encourage you to read the report to find out more about what our research has revealed. I also encourage you to read and provide comments on the new guidance on law and public health emergency preparedness and response, which synthesizes the key recommendations from the new report. And both documents can be found on the IFRC Disaster Law website, and we will add the link in the chat box. I will now hand over to Emanuele. Thank you.
Thank you very much, Isabelle. We may have questions for you and for other panelists. I will try to move through the panelists and then go back maybe at the end with question in the interest of time. Sure. We are running slightly late, but just by a few minutes. So all is fine, and I'll try to proceed. But please, I really would welcome questions in the chat box so that we can go back to our panelists and keep this very much alive. The next speaker is expected to be the Minister of Health and Sanitation from Sierra Leone, but I understand there are some technical challenges at the moment. So while we try to reconnect with Dr. Demby, I would welcome Mr. Navatna Krishnamra, who is the Director General of the Department of International Organization at the Ministry of Foreign Affairs in Thailand. Mr. Krishnamra first joined the Ministry of Foreign Affairs in 1992, and prior to assuming his current role, most recently served as Director General, Department of Protocol and Minister, Royal Thai Embassy in London. And I have one question for you, Mr. Krishnamra, and the question is about Thailand. Thailand has considerable experience in responding to public health emergencies and a range of natural hazards. In 2016, Thailand also helped formulate and continues to champion the Bangkok Principle under the Sendai framework, which seeks to integrate health into disaster risk reduction and vice versa. The COVID-19 pandemic has further highlighted how important it is for countries to increase coordination between health and disaster risk management sectors. What key lessons can Thailand share about how law and policy can support a more integrated and a multi-stakeholder response to public health emergencies.
Emanuele, and good afternoon. First of all, allow me to thank the organizers for putting together this useful event, and I'm honored to be on this distinguished panel to share and learn. I congratulate IFRC for the new report that is being launched today. And let me begin by saying that the Thai experience is still far from over. And like many other countries, we've been persevering through different waves of the pandemic, and we've recorded both successes and challenges. And as in common with many others, we've had to relearn lessons as we proceed. Our actions and reactions to the pandemic have been based on a long experience on prioritizing public health, and our experience in the Asia Pacific in dealing with previous health emergencies, from avian influenza to SARS and others. You've mentioned that we've had many emergencies in the Asia Pacific. The experience has shown that health emergencies have far-reaching impacts beyond public health, and our multi-sectoral approach is indeed the only means for a sustainable solution nationally and globally. More specifically, at the national level, what you mentioned, the whole of society, whole of government response is the best chance for timely and effective response. For this, effective legislative and administrative tools are needed. We have our Communicable Diseases Act of 2015, which was designed to ensure the fulfillment of obligations under the IHR. As such, it involves a multi-sectoral approach in prevention, detection, and response of communicable diseases, with a centralized structure being replicated at the provincial level. But as we all recognize, the scale of COVID-19 was so massive and global that additional tools were needed, and as such, more integrated approaches to international travel, domestic movements, and quarantine that did not merely involve points of entry, but incorporated risk-based analysis so that the system could cope with the numbers. So we passed an emergency decree to ensure even stronger coordination and timely responses, and we've been considering relevant changes to the Communicable Diseases Act to incorporate lessons learned on disease prevention, screening, and responses. And this is where the Bangkok Principles that you mentioned comes in. Even before the current crisis, multi-sectoral coordination formed an inspiration for our efforts with various partners. So the Bangkok Principles were adopted in 2016 at the International Conference on the Implementation of the Health Aspects of the Sendai Framework for Disaster Risk Reduction, 2015 to 2030. What came out as the Bangkok Principles are a product of intense deliberations amongst many sectors, from health, humanitarian, disaster risk reduction spheres. That's proof again of the cross-cutting nature of crises. From our Thai viewpoint, the 2016 conference was an important collaboration between UNISDR, now UNDRR, WHO, and our Ministries of Public Health and Foreign Affairs in bringing the wealth of experience needed to fully appreciate the comprehensive aspects of humanitarian crises. We knew then what was needed to address the health dimensions of a crisis, but the Bangkok Principles provided guidance on exactly what we believe now will help countries to prepare for the next outbreak. This includes strengthening resilience of health systems and better managing risks of health emergencies. And within the guidelines of the Bangkok Principles, we also speak about investments in health facilities and infrastructure, health education, and building capacity for health workers in disaster settings. And of course, cross-sectoral and transboundary collaboration. And just a couple of short examples of how we've been putting some of this into practice. Thailand has relied heavily on our community outreach through nationwide village health volunteers and migrant health volunteers. This is, they've been part of our frontline response to COVID-19, reaching out to communities, migrants, as well as locals, to provide recommendations on preventive measures. During any public health emergency or disaster, of course, information is critical and life-saving. But the general population will have access to plenty of information, but this has to be managed through proper crisis communications. But being able to reach those farthest behind, leaving no one behind, will strengthen the entire response to any emergency, and this will mean victory over any crisis. So the pandemic has highlighted the necessity for equitable, affordable, and timely access to healthcare. Thailand has a universal healthcare coverage system enshrined in our National Health Security Act. And this is at the heart of investment in a robust public health system, catering for the Thai population. But we've learned from previous crises, as well as through the COVID pandemic, that healthcare services need to reach beyond Thai citizens. As has been mentioned earlier, no one is safe until everyone is safe. So basic health services and access to vaccines have to be based on health considerations and prioritization of risk groups without discrimination if we are to reach further. During the last few months, special regulations for vulnerable groups, including migrant workers, the priority has been given to increasing access to screening processes, whilst we're also exploring how migrant workers can access universal health care in Thailand as a temporary measure, but also as a part of our efforts to ensure access is realized as a basic human right. And also stay permits are being extended to enable migrant workers to avoid the dangers from traveling. Allow me to end these short observations by reiterating our commitment to work with partners, including through the Global Health Security Agenda has been mentioned, to promote collaboration and discussions on pandemic preparedness and response. We are part of the supporters of the idea of a pandemic treaty, and we look forward to taking forward the Bangkok Principles and universal health coverage with other partners. I thank you, Emanuele.
Thank you so much, Mr. Krishnamra. A very, very important contribution to this discussion, and the focus on multi-sectoral approach is extremely welcome, and thank you for the leadership that your country has demonstrated over a number of years in this area. I would like to place a question to you, and I will do it maybe after a short video that we'll present, and it's about the Southeast Asia approach. I will moving beyond Thailand, knowing that the Southeast Asia is no stranger to the impact of natural hazards and has a well-established mechanisms for working together in preparing for and responding to such events under the Asean Agreement on Disaster Management and Emergency Response. So I will ask you, how has the regional cooperation worked during the pandemic, and are there opportunity to strengthen these regional mechanisms for public health emergencies? But I will give you 5 minutes to reflect on the answers, and I wanted to just move a little bit east to Fiji to present a 5 minutes video by Mrs. Vasiti Soko, who is the director of the National Disaster Management Office in Fiji. And Mrs. Soko has led her team to respond to 3 tropical cyclones since commencing a role last year, flash flooding and storm surges in all in the context of COVID-19 pandemic. And prior to join the National Disaster Management Agencies, Mrs. Soko worked for more than 10 years in the field of geospatial science and surveying, contributing to several significant projects in the Fijian government and the private sector. As said, due to the time difference, Mrs. Soko is unable to join us live today. However, she has prepared a short video to share with us what Fiji has learned about the role of law and policy in responding to public health emergencies and other types of disaster. And just a way of background, Fiji was struck by a Category 5 cyclone at the outset of the COVID-19 pandemic, and this experience prompted the government of Fiji to review its emergency response system, including its disaster management law, to ensure a more integrated approach and clearer roles for the National Disaster Management Agency in public health emergency. So we'll go to this video in a second, and then Mr. Krishnamra, I will come back to you for a reflection on the regional perspective. We don't seem to have the voice. While the technical glitch is being solved, then Mr. Krishnamra, can I then go back to you to ask for your reflection, and hopefully we'll be sorting out the problems with the video.
Certainly, and thank you, Emanuele, for your questions. Indeed, for Thailand, cooperation within the ASEAN framework is important. As we prioritize a whole of government and whole of society approach in country, we have also seen this being reflected somewhat within the ASEAN framework. And the ASEAN cooperation framework in the 3 pillars have worked towards immediate responses to the pandemic, as well as longer term resilience. First of all, in pooling resources, a COVID-19 ASEAN Response Fund has been established, aiming to assist in the procurement and allocation of medical supplies and equipment, as well as procurement and development of vaccines and medicines. And so the last few months have seen pledges to the fund, and we are looking at the next phase as to how procurement of vaccines can actually take place. But efforts have been underway. Thailand, for one, has pledged to make an initial contribution of PPEs, favipiravir and thermometers towards the reserves. Secondly, we've been developing a common set of health and safety measures, including discussion of the ASEAN Travel Corridor Arrangement Framework. This has been quite problematic and has taken time to evolve, but that's an ongoing issue. On long-term health resilience, ASEAN has announced the initiative for the establishment of the so-called ACFED, the ASEAN Center for Public Health Emergencies and Emerging Diseases. This will, when established, will serve as a center of excellence and regional resource hub to strengthen regional capacities to prepare for, prevent, detect, and respond to public health emergencies. Thailand is paying a great deal of attention, and we've offered ourselves to be a potential site for the ACFED. The mechanisms under the ASEAN Agreement on Disaster Management and Emergency Response, or ADMA, there are various mechanisms, including the Coordinating Center for Humanitarian Assistance for Disaster Management, or the AHA Center. There is one depot in Thailand, which has been operational since July 2020. That's the Disaster Emergency Logistics System for ASEAN, or DELSA, in Thailand. And this is the satellite warehouse that has been providing resources for those in quarantine. Some kits were provided to people in Cambodia, as well as migrant workers from other ASEAN countries in the country. And by the end of this month, by the end of July 2021, an additional number of kits will be deployed to various beneficiaries. And we are also consulting on whether such supplies can benefit other neighboring countries. At the recent ASEAN summit last year, we adopted the ASEAN Comprehensive Recovery Framework with 5 broad strategies, and this is looking at the longer term, enhancing the health system, enhancing human security, economic measures, enhancing digital transformation, as well as a more sustainable and resilient future. And these are some of the ASEAN initiatives that have been underway during the last 1.5 years, and a lot of work in progress, and Thailand is very much committed to our role in enhancing ASEAN cooperation and meeting the pandemic.
Thank you very much for this comprehensive response. There's a lot that the world has learned from Asia during this pandemic, and it's fantastic to see how much work is ongoing, and the world will continue to look at Asia and the lessons learned. So thank you for sharing this contribution. I'm gonna go back to the video from Mrs. Soko, Director of the National Disaster Management Office in Fiji, and I hope that our colleagues were able to sort the technical problems. So, Gabriel, over to you.
2020, Fiji was hit by Tropical Cyclone Harold. At the same time, we had our first case of COVID-19. Like many other countries in the world, this gave rise to several issues that complicated our response operations, such as the limitation to the number of people, gathering, social distancing requirements, and curfews. COVID-19 has accentuated the need to strengthen the harmonization of our laws and regulations to ensure a strong multi-hazard coordination approach that sets out clear roles and responsibilities for DRM implementation at the national level, which also meet the best international practice set by the International Public Health Regulation, the Bangkok Principles, Sendai Framework, and the Paris Agreement. Existing national disaster risk management structures that countries have invested heavily in have been tried and tested during response to other disasters should be strengthened to cater for emerging disasters or emergencies, including pandemics. The harmonizations of these structures is necessary because introducing multiple sets of parallel structures would not only be costly, but also confusing and counterproductive. In many disasters or emergencies, there are certain constants that will always be present. At the center of these constants are the impacts, the impacted people and the assistance that they will require, including psychosocial support, first aid, medicine, logistic support, wash facilities, shelter, evacuation centers, and in the case of an outbreak, a quarantine support during emergency response phase, the early recovery phase, and the long-term recovery phase. To cater for all these emergency phases, a whole of society coordination approach is required. This coordination and engagement require NDMO leadership and management, as this is NDMO's main area of expertise from preparedness up to when long-term recovery kicks in, where operation will then be passed back to Ministry of Economy and other sectoral ministries to take forward under their normal mandate. With the emergencies of the critical importance of DRM and climate change, we find that this consideration must be factored into the response and recovery planning through the preparedness stage. And a constant here for all hazard is the need for accurate risk information data. In drafting the text of our DRM bill, we are taking multiple risk hazard approach and a whole of society people-centered approach. We hope to introduce a risk governance structure that links across the international, national, and subnational right down to community level. Whereas we understand that there is other hazards managed by other risk managers, example, the health, biosecurity, environment, fire services, aviation, and maritime, we hope to create linkages where we can support them during emergencies in their respective mandate as they support NDMO when natural disaster declaration is in place. At the regional level, the Fiji NDMO is the deputy chair of the FRDP, Pacific Risk Governance Technical Working Group. The FRDP is the Pacific Integrated Approach to coherence in climate change and disaster risk management. It has 3 main goals. One is to strengthen integrated adaptation risk reduction to enhance resilience to climate change and disasters. 2, low carbon development, and the third one is to strengthen disaster preparedness, response, and recovery. The TWG brings together Attorney Generals, Office legislative drafters, and NDMO or NEMOS directors from around the region for peer-to-peer support and sharing. The deliverables of this TWG include a published study on the regulation of international assistance law for 18 Pacific Island countries with regional recommendation, and with assistance of IFRC have also undertaken to do a regional public health emergency study for 8 Pacific Island countries. And thank you very much.
Well, thanks to Mrs. Soko for this important contribution, which once again reiterate that epidemics don't happen in isolation from other disasters, and that investments in response to public health emergencies needs to go with response to other emergencies. And of course, the climate change is acutely stressing the need for more robust frameworks that link health to other disasters moving forward. And once again, the point of an all of society approach was reiterated as in line with what had been mentioned earlier by Mr. Krishnamra. So I'm very glad for this contribution. We're going to I'm glad also that there are questions coming into the chat box. So we'll keep them and then we'll bring them back to the panels when we have finalized the presentation. I would like now to go to an institution that has been central to the global response to the current pandemic and other epidemics. We're going to go to WHO, and I'm happy to have with us Stephen Solomon, who heads the WHO's Legal Office Unit on International, Constitutional, and Global Health Law. And in addition to providing legal support for the organizational response to the COVID-19 pandemic, he focuses on the normative global health matters, including international health regulations, the very important Framework Convention on Tobacco Control, and the Pandemic Influenza Preparedness Framework. Prior to joining WHO, Mr. Solomon served as Deputy Legal Counselor at the United States Mission to the United Nations organizations in Geneva. So my question to you, Stephen, is as the new report finds, there remain significant gaps in the domestic implementation of the core capacity required by the international health regulations. In your view and your institutional view, how can domestic laws and policies better support the implementation of the IHR core capacities?
Emanuele, thank you, and thank you all very much. Privileged to be here with, as so many have correctly identified, this distinguished panel. Privileged to speak after your distinguished opening speakers, and a really pleasure to be here, and looking forward to answering questions. And I just want to also acknowledge my distinguished colleague, Carmen Dolia, who is one of the principal leaders of WHO's work on the IHRs, who will also be available for Q&A. I think your question could not be more timely, could not be more relevant. I think I'd like to divide my answer into sort of 3 segments. First, on the role of law, both international and focusing on your question specifically domestic, so the role of law. Secondly, on the concept of sharing, and sharing not only being caring, but sharing being essential. And then thirdly, on next steps. And I'll try to do this all within your, the next 4 minutes and 30 seconds, because I know we're time sensitive here. So on the role of law being critical, it's clear that the IFRC has brought so much to this field and so much in the development of disaster law, recognizing that this fact for preparedness. I think our IFRC colleague talked about that there is so much that is foreseeable, and therefore so much that can be done to prepare in advance for issues that arise. And I think actually you've mentioned the Pandemic Influenza Preparedness Framework. I'll touch on that in a moment about how that is exactly this idea of advanced preparation, not waiting until the fire has started to get the hoses ready, but actually having them all set up so that they're right at hand when that fire starts. But I want to talk for a moment about law as a sort of in a conceptual framework sense. So it is very important to enact laws at the international and domestic level. It is equally and maybe more important to keep active the laws themselves. So enacting is one thing, and that's where the glitz is, and that's where the interest often is. But it is the keeping enacted laws active, which is the day-to-day work, the brushing your teeth, if you will, that just has to be done. And it is the same thing with core capacities and with the law itself. What we've seen with the IHR, and I'm sure my colleague Carmen can comment on this, is we have an extraordinary instrument. We have an instrument with 196 states parties. That's 2 more parties than belong to the WHO as member states. It is one of the most widely subscribed, internationally legally binding instruments, but there are problems with it. Despite it being applicable to every country as a matter of law, despite many countries having domestic regulatory or legal schemes enacting some or all of it, it is a complex regulatory framework which needs activity behind it. The report of the IHR Review Committee has pointed to this issue. It's pointed to the fact that there is a lack of what we would see in many instruments, which is a regular process of renewing understanding about the instrument. The IHR does not have an annual conference of the parties. It gets a couple of hours discussion at the Health Assembly, but it doesn't really bring people together. This is the idea of keeping law active and keeping fresh in the minds of so many people and so many ministries that have to deal with this, keeping fresh the understanding of the law. As I said, very often very complex areas, but I will tell you just as an example of this, even among experts who follow the IHR, there is uncertainty, and we have seen this in the context of COVID, about one of the most central aspects of it, which is the declaration of a public health emergency of international concern. And I'm not only talking here about how different people pronounce that weird acronym differently. Some call it a FAKE, which is just an awful acronym when you think about it. Some call it a FIC. But I'm talking about what the legal implications, the normative implications of a declaration of a FIC are. This is not as well understood as it should be. This is not as clear as it should be. And there is more work that can be done to make this clear at an international level and at a domestic level. And certainly, one of the most important elements is not the headline grabbing declaration of a FIC, but rather the non-headline grabbing, day in, day out, sustaining of core capacities in every country. And so ensuring that the boring gets as much attention as the exciting is a very important job and a function of particularly lawyers in the legal community. So that's the first thing, the role of law. Second thing, this idea of sharing is caring. We all know that phrase, it's taught to our kids, it's good policy. What we've seen here is sharing is also essential. It's essential to advance. It's a matter of enlightened self-interest, essential to the response to the pandemic, and the role that law can play in this in many areas is clear. Obviously, in terms of the IHR, the sharing of information, the sharing of response, the sharing of other things is within the IHR is important. But sorry about that. I'll turn that off. That's my watch, which monitors my activity. The other thing that sharing is important about is sharing of access to the pathogens themselves, sharing of access to the responses to the countermeasures that are produced by those pathogens in terms of diagnostics, medicines, vaccines. And having a legal framework for that is important. I'll illustrate that by referring to the PIP, as I said I would. The PIP deals with pandemic influenza situations. It is not applicable to COVID because COVID is not influenza. PIP is restricted to influenza. But PIP has prepared in advance a regulatory scheme where at the next pandemic influenza situation, there will be to WHO 10% of vaccine supply against pandemic influenza for use based on public health needs. That is set in legal terms with the manufacturers already. Had we had that for emerging or novel pathogens, this issue of vaccine equity would probably look very different. So it's where we have a foreseeable issue, and it is foreseeable that there will be future pandemics and epidemics involving emerging and novel pathogens. It makes sense. It makes sense from this point of view of common interest to have that available. And finally, in terms of what's next, it's already been mentioned that there's discussion of ideas of new normative instruments, new arrangements for working together, whether that's GHSA, GHSI, some combination of countries, or whether it's on the basis of the proposal for a pandemic treaty has been mentioned, which is going to be taken up at a special session of the Health Assembly in November. Many different ideas floating around on what to do next for pandemic preparedness and response. From a WHO perspective, the importance of having an inclusive process, a process which involves whole of society, all of government, and a One Health approach cannot be overstated. So there may be different ways to address that. There may be different fora in which to address it. But clearly these criteria, inclusivity, all of government, whole of society, One Health approach would seem to be essential to ensure a better preparedness and better response against future epidemic and pandemic threats.
Thank you very much for your comments. For me, it's been important to listen to the distinction between having laws, enacting laws, and keeping enacted laws active. And that's a critical point. I do have a question that I'll come back later, because I see that there are questions are popping up. So I'd like to finish, but one question that maybe would be for you or your colleagues, Carmen, that I know has joined us, about the voluntarily elements of some process like joint external evaluation vis-a-vis compulsory elements, and how are you within WHO thinking about the future? And that is linked to a pandemic treaty. Where do we go? We'll come back to that in a few minutes. And I would just go to our last presenter for today, which is Mr. Alvaro Montero Sanchez, who is the General Director of the Costa Rican Red Cross. He previously served as operations manager and has been a Red Cross volunteer since 1985. Mr. Sanchez has dedicated his career to disaster risk management and has experience working for national and international agencies specializing in disaster risk reduction and response, including the Costa Rican National Commission for Risk Prevention Emergency Response. And similar to our previous speaker, due to the time difference, Mr. Sanchez is unable to join us live today. However, he has prepared a short, and I've been told, very engaging video to share with us to how the auxiliary role of the Costa Rican Red Cross has been legally recognized, and how this has enabled it to perform its role as a first responder during the COVID-19 pandemic, including in providing pre-hospital care to people with suspected and confirmed COVID. As Isabelle mentioned, legal recognition and support for the role of humanitarian actors is one of the key recommendations in the new report. And with that, over to Gabriel to hopefully share with us the presentation by Mr. Alvaro Montero Sanchez.
Desde Costa Rica. En esta emergencia sanitaria, la Cruz Roja costarricense ha estado trabajando en pro de nuestra población, y una acción significativa ha sido el traslado prehospitalario en casos sospechosos y confirmados por COVID-19 de más de 27.000 pacientes desde marzo del año 2020 hasta junio del año 2021. La Asamblea Legislativa de Costa Rica nos declaró como institución benemérita de la patria el 3 de noviembre de 1989. Esta denominación significa el reconocimiento del Estado y el pueblo costarricense a los actos de heroísmo cotidianos que impactan en cada respuesta de nuestros voluntarios y voluntarias brindan a la ciudadanía. Adicionalmente, en marzo del 2020 se obtiene la declaratoria de institución de utilidad pública en reconocimiento a nuestro rol auxiliar del Estado y la labor humanitaria en todo el territorio nacional. En 1922 nos incorporamos como parte del Movimiento Internacional de la Cruz Roja y la Media Luna Roja. Y desde 1952, la Cruz Roja costarricense desarrolla sus actividades al amparo de la Ley de Asociaciones de la República de Costa Rica y su reglamento. Somos auxiliares de los poderes públicos en aquellas actividades en apego a nuestros principios humanitarios y a nuestra misión, que indica salvar vidas, prevenir y aliviar el sufrimiento humano en todas las circunstancias a través de la labor humanitaria y voluntaria que contribuye a una sociedad resiliente, inclusiva y preparada. La Cruz Roja costarricense ha estado en la primera línea de respuesta en la actual emergencia, tal y como lo establece el artículo 2 del decreto que declara emergencia nacional la pandemia por COVID-19 y el artículo 20 del decreto que establece la vacunación obligatoria del sector salud, en la cual se incluye de forma directa a los miembros de la sociedad nacional. Sin duda, esto contribuye a la puesta en práctica de acciones que se lleven a cabo desde la articulación interinstitucional, en donde se mantiene activa la participación en las reuniones virtuales ordinarias y extraordinarias de las diferentes instancias de acuerdo al artículo 10 de Ley Nacional de Emergencias 84-88, con múltiples mecanismos para la coordinación entre las diferentes instituciones involucradas en el manejo de la pandemia a nivel nacional. Además de lo anterior, nos hemos mantenido en permanente coordinación y comunicación con las estructuras de la Federación Internacional de la Cruz Roja y el Comité Internacional de la Cruz Roja presentes en la región. En apego a todo lo anterior es que hemos venido trabajando en campañas de prevención del contagio, atención hospitalaria de pacientes víctimas de la pandemia y acciones de apoyo a los centros de vacunación por el COVID-19, pero sin descuidar nuestras operaciones ordinarias y extraordinarias para la atención de emergencias y desastres a lo largo y ancho del país.
Somos la Cruz Roja costarricense.
Well, thank you very much, Mr. Moreno, for the words, and I will now open the floor for the Q&A sessions. We have around 20 minutes, and I hope we can move fast on the many questions that are appearing. And I will start maybe with a question to Carmen, who's joining from WHO, and Stephen, about the legal binding instrument, the pandemic treaty, and potential regional treaty. There's a question from Rajiv that is asking, do you think there is a possibility to have regional treaties on disaster law, and what kind of emergency law responses to COVID-19 have been adopted in conflict-affected settings? So what do we do in those settings specifically? So maybe over to you with some reflection on the next steps on the pandemic treaty, where to go, and maybe on that issue that I mentioned earlier about voluntary versus mandatory. So maybe you start with Carmen now. And then
maybe Carmen can take that question first, and then I'm happy to come in on the treaty and then this concept of regional treaties. Thanks.
Thanks very much, Steve, and thank you, Emanuele, and colleagues, and thank you for the opportunity to present. So my name is Carmen Dolea. I'm the head of unit of the IHR Secretariat in WHO in the Emergencies program. To respond to the question on the universal peer review mechanism, this has been discussed at length by the review committee on the functioning of the IHR. As you know, this is the fourth time that the IHR, the instrument that Steve has mentioned, which is this extraordinary framework that binds all countries for preparedness and response to emergencies or to diseases that cross international borders, rather. It has been reviewed at the request of the Director General, and while the functioning of the IHR was considered, or the IHR themselves, the design was considered fit for purpose, there was a lot yet to be gained from a more effective implementation, particularly with regards to the compliance elements that you raised, Emanuele. Also, the issue of the joint external evaluations, or rather assessments of the core capacities which are required by the IHR, has been discussed at length of the committee, and they have been appraised by experiences of the Office of Human Rights Council with the universal periodic reviews that is happening for the application of human rights obligations in countries. And the committee made a specific recommendation among the 40 recommendations for WHO to work with state parties to implement such a peer review mechanism, universal peer review mechanism, which will basically foster a multi-government, multi-sectoral approach of bringing everybody on board to understand what is the level of capacities development in the countries, what is the way the countries are, what are the ways the countries are responding to emergencies, and what are the gaps in these issues. And part of that is also another novelty, if you want, of the review committee, which is relevant for this discussion today. They actually identified legal preparedness as one of the key elements in pandemic preparedness. And they had a specific recommendation, specific chapter related to that. And they do recommend countries to put much more emphasis on the legal frameworks and legislative policies that need to be in place to implement effectively the recommendations of the IHR. And they also discussed the issue of the treaty. And if you read the report which was presented to the member states at the Assembly, there is actually an identification of elements that are not covered currently by the IHR, particularly the fact that there is no definition of the pandemic in the IHR. As Steve mentioned, there is the issue of a public health emergency of international concern, for which there are provisions in terms of what countries can do, which are basically the temporary recommendation issued following the advice of an emergency committee. But for a pandemic, apart from a pandemic influenza, there is no kind of legal framework to provide for the actions or the decisions that countries need to take in this purpose, in this regards. And the review committee has identified a few elements, Steve alluded to, sharing of samples and information and viruses, providing the legal framework for developing countermeasures, the supply chain, the global workforce. So these elements are not extensively covered in terms of legal provisions under the current IHR, which is a legally binding and an opt-out instrument. And Steve can comment on that if there are further questions. But there are elements that need to be taken into account in terms of specifically pandemic preparations. And on the issue of the fake and intermediate level, also last point I want to make is about the proposals from the review committee. It's not the levels that are missing or are creating issues or troubles, it's the actions that are coming out following a public health emergencies or any other risk alert. That's why they are proposing not to implement an intermediate level of alert, but rather for WHO to be much more proactive and open and transparent in providing specific risk assessments and specific actions related to the events that require international coordination and response. They call it something like World Alert and Response Notices, which would complement the existing mechanisms that IHR has in place to inform and provide epidemiological and clinical information about diseases with more specific response actions. What are the elements that countries need to do to be able to respond to the diseases and events reported? I'll stop here and over to Steve for the regional treaties question. Thank you again.
Thank you. And I'll just say very quickly, one of the nice things about WHO, of course, is it has a very a robust regional structure. We have 6 regions, we have 6 regional offices with regional directors. So there's a good way to sort of bring regions together and make coherent their thinking, their systems, their regulations in a global context through the World Health Assembly. And just a quick word on global health law. The reason I'm sometimes surprised it's not more, it's not more widely studied in law schools is because it's really so simple. There's only 3 broad instruments for all of global health law. And that leads to what's next for the possibility of a pandemic treaty. This is the WHO, you can't see it, but there's the WHO Constitution from 1946. There's the FCTC from 2004, and there's the IHR from 2005. You don't have to study a lot to see essentially. Now, there's lots of other things that connected with it, but those are the broad ones, because the Health Assembly doesn't do this a lot. It doesn't use its powers to create binding international law very often. The question, one of the things member states will be asking themselves in the run-up to this special session is, should we do this with respect to future pandemics for exactly the reasons Carmen went through? There's some gaps. And that, I think, for your audience will be most interested to know, there's going to be a robust intergovernmental process leading to a 3-day special session of the Health Assembly beginning on November 29th, 2021, lasting for 3 days to consider what to do to go forward. And the WHO Secretariat will support that process. We'll see, keep your eyes on this space. We'll see what member states decide to do with respect to all the various proposals, which include a proposal for a brand new treaty, what would be the big number 4 of the 3 I just listed for pandemic preparedness and response.
Thank you very much, Carmen. Thank you, Stephen, for this enlightening clarification about where we're headed and where we are coming from. You made it sound very simple. We have just 3 things. So that's what lawyers do. And then in the details, there are problems, but lovely. I want to go back to Thailand, though, now, maybe to ask Dr. Krishnamra and there's a question from Kirsten Buchmiller in the US, and she's asking, in regard to the new proposed global pandemic treaty, from your perspective, what would be key elements you would like to see incorporated in such an agreement that are not being addressed by the current coverage within public health emergency or disaster law? And maybe if I can just add one once, what would have been helpful for you in your country to have that wasn't there?
Thank you, Emanuele. I think that Stephen Solomon referred to the potential answer. I think a lot of us were wanting more clarity on whether, what WHO, what the global body would say about a pandemic. In clear terms, so that states could adequately prepare. The IHR as has been mentioned, doesn't mention this clearly. The FAKE, the PHEIC, of course, the new steps incorporated. People don't understand that. They still refer to the old terminology and refuse to be taken in by technical terms, and so they would prefer a clearer procedure or a number of steps they can understand, and the states can alert their citizens and their agencies accordingly. I think Stephen Solomon also mentioned core issues regarding process, which we agree with absolutely, that it has to be inclusive, has to be whole of government, whole of society, and incorporate the One Health perspective. These are some of the concerns that we believe should be built into discussions on in November. And also to be built in is perspective that a strong universal health system health coverage should underpin whatever arrangements that are being discussed.
Thank you very much. Thank you for this answer and the underpinning of the universality of the approach. Very relevant. Isabelle, I'm coming back to you. There are a couple of questions for you. One coming from Miriam Alba Reina is about the role of the private sector. She is reflecting that the COVID-19 pandemic revealed the pivotal role of commercial flights providers and producers of health materials, like for instance PPEs, in the response to the crisis. In your view, should prevention and preparedness activities extend to the private sector? And I would say, regulations extend to the private sector, and if so, how?
Thank you, Emanuele. Yes, absolutely. When we're talking about a whole of society approach, One Health approach, we mean defining the roles and responsibilities of all actors, which will have a critical role to play in the response to the disease. So, of course, commercial flights providers also have a critical role to play. This being said, it's also important to provide legal facilities for these actors to make sure there's no blockages, as an example, in terms of landing of flights or entry of the goods in the country or custom clearance of these goods. It's also important to understand, however, that in most situations of disasters, there are a lot of unsolicited goods that are being sent to countries affected by disasters, and this can also apply to public health emergencies. So it is also critically important to put in place some control mechanism to make sure that the good aid comes in, but the bad aid does not come in. So their states should prepare in defining who are those critical actors who will have a role to play in the response, and make sure that legal facilities are in place to facilitate speedy entrance of the assistance, and also provide them with simplified procedures and priority access. So that would be my first answer to my first question.
And Isabelle, second questions, and again, very difficult to synthesize, but I will ask you to be very brief. From Kim Raj, Nepal, would be interesting to know about any difference or similarity between legal frameworks in public health context in high income and low income countries. Is there any good example available to share? What has emerged through the report in terms of similarity and a striking difference between high income and low income countries?
Okay, so what we have noticed through the surveys of countries that in the report is that there are three types of legal framework in place to manage public health emergencies. The first type of legal framework in place is mainly through health laws. So basically, the management of public health emergencies will find its legal basis in health law. So that's the first type of legal framework in place. The second one is the hybrid between health laws and disaster risk management laws. So the laws will provide some, roles and responsibilities. As an example, leadership role in the management of the response to the public health emergency to health authorities. But as an example, for the state of disaster, state of emergency, it can be provided through disaster risk management laws. So this is the second type of main similarity we've found. And the third type of legal framework is led by disaster risk management law. It means that in some countries, public health emergencies are fully managed through disaster risk management laws. And this by definition means full integration between health regulation and disaster risk management laws for the management of public health emergencies. So these three types of legal framework we've noticed throughout the different mappings we have completed. And honestly, there is no main difference between developed country and undeveloped countries. This is a mixed. It's really a mix, and there's no evidence that one system is better than the other, because we don't have any evidence on this. But of course, what is important is that there's complementarity between the health laws and the disaster risk management laws, that the roles and responsibilities are fully provided for all actors who will have a role to play in the response, coordination mechanism, communication mechanism, which were already highlighted by the panelists during the session. And it's important to avoid gaps, duplication, and contradiction as well between the frameworks that are in place. Thank you.
Beautiful. We are 1 minute to go, and I have two favors to ask. So to our panelists, I would like you to conclude with one tweet, one sentence that you would want to leave with us to improve for the future based on the discussion we have had today. The second question is to our people online, if you can turn on your cameras, if that is okay, just for our team to take a picture of some of the participants. And so we'll go then quickly in 1 minute to close to be on time. Stephen, may I start with you?
Yeah, I would go back to what I said about sharing. Sharing is caring, sharing is essential, sharing is smart.
I can use it for my kids too.
Yeah, it really is true at the family level, at the national level, at the international level, because we are all in this together. Pathogens affect everyone.
Excellent, Stephen. Thank you very, very much. Mr. Krishnamra, over to you.
Effectiveness is breaking down silos. We have silos in the health dimension as well.
Excellent, excellent. Thank you very much. Isabelle.
I would say that legal preparedness is key for the effective management of public health emergencies, and the IFRC network stands ready to support states in strengthening their legal framework.
Fantastic. And I don't have anything to add besides just re-underline the point that Isabelle just made, that we are ready to work on the legal front, as we are working on the preparedness front, as we are working on the response with the many partners that have joined us today. I hope this was a good use of 90 minutes of your time. Certainly it was for us. The report is out, and as Isabelle mentioned, there is further work on a simplified guidance document that is out for feedback, and we look forward very much to remaining in touch. Once again, thank you to all the panelists for joining us and for sharing their valuable insights. Thank you to all of you, and there are quite a number, more than 100, joining us from different parts of the world. It's great to have you, and looking forward to being in touch in the future. And have a very good day, afternoon, evening, or night. And bye-bye.
Thank you. Thank you to all.
Bye-bye.
Bye.
Thank you. Bye-bye.
Thank you. Bye-bye.
Thank you.